welcome back. Now, this month is Diabetes Awareness Month, and of course, as we're going to close out November, we should focus on children who are living with the disease. And Dr. Lindsey Rauch is a pediatric endocrinologist from Nationwide Children's Hospital in Toledo, joining us. Thank you so much for joining us this afternoon.
Thank you for having me.
So, sometimes folks will think, because, diabetes, clearly it's because you eat too much sugar, and so naturally it's mom and dad giving you too many sweets, and that's how you ended up being a diabetic.
Absolutely not. That's not the case at all. So there are several different types of diabetes. The two that we mostly treat are type 1 and type 2.
Okay.
So diabetes itself is just kind of a blanket term for a patient who does not make enough insulin to help keep blood sugars under control. In pediatrics, the most common one that we see is type 1, and that's actually an autoimmune disorder. So when we think about our immune system, normally it's supposed to be there to fight off things that don't belong. So bacteria, viruses, illnesses, that kinds of thing.
Okay.
Sometimes it gets confused and it attacks the cells in the pancreas called beta cells that make insulin.
Ooh.
And that is when type 1 diabetes develops. So nobody's fault. There's absolutely not the parents' fault.
Not too much cake, not too much ice cream. It just, that's just kind of what happens with the body.
All.
So then what are my signs to look out for if it's not my fault and it's not their fault?
Right. So the most common things that we see are an increased thirst and increased urination. Sometimes that might show up in an older kid as someone who didn't used to wet the bed but started wetting the bed again, or you're driving, we hear a lot of things. We're driving to grandma's house and it's an hour away and we had to stop 3 times for our kid to go to the bathroom. So it can show up pretty apparently. Other things that we'll see sometimes are increased hunger, weight loss, vomiting, those kinds of things.
And when I think vomiting, oh joy. That one's just a normal sign of her living life. But then
Absolutely.
When do I know that I should definitely go to the doctor?
I would say if you notice, man, my kid's really peeing a lot, they seem really thirsty, they're starting to look thin, they seem more tired, just not themselves, take your kid to see their primary care doctor and they can help your child get tested.
Okay. Are there any physicals, like you said, so the thinness, are there any marks or rashes or something like that usually?
Sometimes so, if a child's kind of on the way to developing type 2 diabetes, which we're starting to see in kids, they can have a little bit of darkening on the back, around their neck or in their armpits, so that might be something to watch for. If you see that, that would be another clue to take your child to see their primary care doctor.
And actually, I've read something like that because, of course, when I was growing up, it was the thought of, well, you're just dirty and you need to scrub more. That's not necessarily the case.
No, and I hear that a lot. Parents are like, I've tried to scrub and it doesn't come off. It's like, so,
it's in the body, so that's why. So once you get a diagnosis, the world has ended. We're done now, doctor. That's it. No, there's nothing else we can do.
Absolutely not.
Okay.
So we are so good at treating diabetes now. We have new technology that we have continuous monitors that people can wear to check their blood sugar all the time. We have insulin pumps. We have better insulins than we ever used to have. Our goal really is to make diabetes fit into the life of the child rather than feeling like their life is always revolving around diabetes.
And so are there definitely any other steps we should take to be aware, make sure, and then of course just accept that this is not a terrible thing, like you said, because we're trying to make the diabetes fit into the kid's life because the kid's in charge, right?
Absolutely. I mean, it's a big change, and a lot of parents families are overwhelmed because things change and you have to pay attention to carbs and things that you didn't have to think about before. But once you kind of get the hang of it, the goal really is we want kids to have as normal life as we can. We don't want them to miss out on anything. A lot of parents hear the word diabetes and think my kid can never have sugar again, and that's absolutely not the case. We still want our kids to have their holiday cookies and their treats and still get to enjoy all the things that they normally would.
So as we head into the Christmas season, do not be concerned that now everything is over.
No, absolutely not. We want kids to be healthy, so nobody needs to be eating cake and cookies every day or things like that.
Valid.
And we, certainly it's better if you can have those kind of paired with a meal, but no, we don't want kids to miss out on any of that fun stuff in the holidays.
Dr. Rauch, thank you so much for taking the time. I appreciate it. So of course, again, it's nobody's fault, but again, keep a lookout for those signs and just be aware and be smart. And then if we're not sure, ask the doctor.
Absolutely.
There we go. Thank you. All right, John.